Your residents are counting on you to assist with their medication appropriately. Let's review some important facts that will help you to ensure that medication is always given correctly to your residents. Let's begin by talking about the 6 rights. We will want to start out by making sure we are giving our medication to the right resident. Now, we never simply want to rely upon stating a resident's name as our only method of identification. Because many seniors, if you walk up to them and state a name such as Mrs. Jones, they'll respond, "Yes, yes, honey, yes," simply because you're speaking to them, when they may in fact not be Mrs. Jones at all. Now, in most assisted living communities, we do not use identification bands like you would find in a hospital setting. That is why it's always a good idea to have a current photograph of your resident available on the MAR so that you can easily recognize your resident appropriately.
When giving medication, it's always important to make sure I'm giving the right medication to the right resident. So I often refer to my med book to make sure the picture matches the resident.
Additionally, we will want to make sure that we are giving the right drug. We want to make sure we can clearly read the physician's order and understand the MAR completely. If you are not sure about giving the right drug, perhaps it's confusion over a trade or generic name, always consult with a healthcare professional to make sure that the medication that you are giving is indeed the right drug. We will want to make sure that we are giving the right dose of the drug. Drugs come in a variety of strengths, milligrams, micrograms, etc. You will always want to make sure that you have the correct strength of the drug on hand to be giving an accurate dose. If you are unsure how to calculate a dose of a medication, always ask a healthcare professional for assistance. For example, the dose that you will want to give is 20 milligrams. You have 10 milligrams on hand. Therefore, you would give 2 of the tablets to equal the 20 milligrams. During the following screens, you are going to see some practice calculations. Follow along. It's also important that we are giving the medication via the right route. Now, the vast majority of the medications that we give are simply oral meds that the resident will swallow. But sometimes our residents may take buccal meds or sublingual meds. We may also have residents that use transdermal medication or topical medications. You may also have a resident taking suppositories. Some medications you give may be eye, ear, or nose drops. You may also have inhalant medications, such as nebulizers. Always make sure you clearly understand the route of the medication delivery, and don't hesitate to ask a medical professional to assist you. We also want to make sure that we are giving the medication at the right time of day. Some medications are only given once a day. Others must be given at very specific timed intervals throughout the day. Always refer to your physician's order and MAR to be sure you're giving the medications at the appropriate time. There is generally a 1-hour window on any timed medication unless indicated otherwise by the physician. So for example, if you have a medication timed at 8 a.m., you may give it as early as 7 a.m. or as late as 9 a.m. and still be within the appropriate time frame. We also want to make sure that we are correctly documenting using the right documentation for the medication assistance. Your accurate documentation is critical to your residents receiving the medications appropriately. It's our record that the medications were given, but additionally, it helps us avoid potential errors. So let's again review the 6 rights. We want to make sure we are giving the medication to the right resident, that we are giving the right drug, that we are giving the right dose of the drug, that we are giving the medication by the right route, at the right time of day, and we have documented appropriately. As you prepare to give medication, it is essential that you are focused on the job and ready for medication assistance. You'll want to make sure your work area is clean, neat, and organized. Make sure you have everything available for safe medication delivery. You want to be sure that your cart is well stocked with supplies, that your MAR is available, you have a black pen to appropriately document as well as a yellow highlighter if necessary. You will want to make sure that you have a water source available to be able to pass the medications. Don't forget, if you wear glasses, you'll want to make sure you have those on so that you can safely read your MAR.
I like to be very considerate of the people that I work with, so I make sure that the med cart is stocked properly and ready for the next shift.
Before you proceed to the med cart, make sure you have washed your hands well. Make sure the room is appropriately lit. You will want to make sure that you have your keys ready and available to unlock your medication work area. Make sure you have all your necessary supplies available, such as cups for measuring liquid medications, cups for tablets, gel caps, etc. You want to make sure you have a pill cutter as well as a pill crusher, easily accessible. Now, one of the most important things to consider is as you are working at the med cart, you simply cannot tolerate interruptions. If, however, someone does approach you, make sure that you finish what you're doing before you begin any discussions.
Assisting your resident with their medications is really a 2-step process. The first part involves pouring the medications for the resident. The second step is delivering the medications to the resident for self-administration. We're going to begin by talking about the process of pouring the medications for your resident. The first step when pouring medications for your resident is to open the MAR and to turn to the correct resident's medication records. Use the photographs of your residents as a guide to make sure you have the right MAR for the right resident. Then, using the MAR as a guide, step 2 is to pull the correct medications from your cart, drawer, or other storage area. As you begin pulling medications from the drawer, you want to use what's called the 3-check method. This is a way of ensuring that you are adhering to the 6 rights that we've talked about before. When using the 3-check method, you will verify that you have the right resident, the right drug, dose, route, time, and documentation 3 times during the process of pouring the medications. The first check comes when you pull the medications from the drawer. Check the medication label against your MAR and be sure they match. Step 3 is to then pour the medications into a medication cup. At this time, you will perform your second check, again checking the label of the medication against the MAR. It's very important as you pour your medications that you never touch them. When using a bubble pack, you can simply punch the medication out of the bubble pack directly into your pill cup. If using vials or bottles of medication, you can pour the pills into the cap and then from the cap into your pill cup. After you have poured the medication, Step 4 is to return it to the drawer. As you return the medication to the drawer, perform your third check. Again, checking the label of the medication against the MAR to be sure they match and that you're following your 6 rights. Step 5 is to then bring the medication to the resident and assist them with self-administration, staying with them the entire time to ensure all medications are taken correctly. You should never leave medications alone with a resident. Finally, step 6 is to document on your MAR appropriately. Although these basic steps apply to all medications, some forms or routes will require some additional techniques. Let's start by talking about liquid medications. The most important point to remember when preparing a liquid medication for your resident is to be sure you are measuring it accurately. You never want to simply use a teaspoon or tablespoon from the kitchen. Rather, you want to use an accurate measuring device, such as a graduated medication cup like you see here. When pouring the liquid medication into the container, be sure that it is sitting on a flat, level surface, and you are looking at the lines from eye level to ensure you have an accurate measurement. Topical medications are typically applied to the skin. When assisting a resident with a topical medication, be sure that you are wearing gloves so that you do not come in direct contact with the medication. Additionally, be sure the topical medication is applied to the correct area of the body by verifying with your physician's orders and medication assistance record. Residents with asthma, COPD, or emphysema and other respiratory conditions may require the use of inhalers or nebulizers. When assisting a resident to use their inhaler, it is extremely important that you encourage them to use the correct technique. Be sure to shake the inhaler thoroughly. Encourage the resident to bring the inhaler to their lips, begin to inhale, and then press down on the inhaler to deliver the medication. They want to be breathing in just before they push down to ensure that as much of the medication as possible is delivered to the lungs rather than staying inside the mouth. Typically, a minute or two is encouraged between each puff to give the medication time to work. Additionally, if they are using multiple inhalers, they may have to take the medications in a particular sequence. Finally, the pharmacist may sometimes give instructions to cleanse the mouth after using the inhaler. This can simply be done by swishing the mouth with water or mouthwash after using the inhaler. Some medications are taken by applying a patch to the skin that is left on for some period of time. When assisting a resident with their patch, be sure that you are wearing gloves at all times. Before putting on the new patch, assist the resident to remove the old patch first. Cleanse the area after removing the patch, and then assist the resident to apply the new patch on another part of the body. When preparing the new patch, it is typically recommended to date an initial on the outside of the patch for documentation purposes and to clarify if there's ever any confusion about how long the patch has been on the body. When assisting a resident with eye drops, be sure that you are wearing gloves and that the medication is delivered to the correct eye. Have the resident lay down or lean their head back while sitting in a chair. Gently pull down on their lower eyelid and then drop the correct number of drops into the lower eyelid. Be sure that the medication container never comes in direct contact with the resident.
Some of your residents may require that their medications be crushed. We must always have a physician order to crush a particular medication. We must use our pill crusher properly. Let's listen for some instructions on using a pill crusher.
Pill crushing devices can vary in design, but in this example, the pills are placed in a small clear bag, which is then inserted into the device. You then push down on the handle repeatedly to pulverize the medication. Whichever type of pill crushing device you are using, the most important point is to be sure the pills are pulverized completely before putting them into your applesauce or other food that is being used to deliver the medication to the resident.
We will want to make sure that we know what we can mix the crushed medication into. Applesauce is a common food we use simply because of its balanced pH. Some of your residents may prefer yogurt or ice cream, but always check with your pharmacy to make sure the medication can be safely mixed in such foods. Whenever you're giving a medication that has been crushed to the resident, always let them know what medication they're receiving. We never crush medication for the purpose of forcing it into a resident against their will, but rather to enhance the palatability of the medication and to make it easier for the resident to swallow. A consent to crush medication is required by some regulations. Know the regulations for your state. Sometimes you may find that a resident will refuse to take their medication. It's very important that as a good med aid, you listen carefully as to why they are refusing the medication. You know, most of us during the course of our lifetime have had a physician prescribe a medication for us, and for one reason or another, we simply did not want to take the medication. Maybe it made us sleepy, maybe it gave us a headache, maybe it made us kind of nauseous when we took the medication. Our residents are no different. Listen to why they do not want to take their medication so that we can forward that information to the resident's physician.
I've got your morning pills.
No, I don't want to take that. I told you I'm not going to take that pill.
How come?
I don't want to take it. I'm not going to take it.
Whenever a resident initially refuses a medication, don't just stop there. Always try a few more times. Sometimes a change of face helps. Having a different med aid give the medication to the resident may work out just fine.
Sometimes a resident just might not want to take their meds from me today, so I'll ask another med aid to get the pills.
Sometimes a resident simply isn't quite ready at that moment to take their medications. Reapproaching them 15 or 20 minutes later, you may find they're then ready to take the medication.
Sometimes I'll give them time and walk away, and I'll be completely surprised that they'll be ready to take their pills just 10 minutes later.
If you've tried everything and the resident is simply not going to take the medication, then the medication will be destroyed and the MAR will be appropriately documented, indicating the reason why the resident refused the medication if it is known why. We then must contact the resident's physician to notify them that the resident has missed a dose of the medication.
It's so frustrating when a resident refuses to take their medication, but I have to keep my cool and know that I cannot force a resident to take their medication.
For many residents, refusal of medications is a control issue. They have given up so much in their life, and it's very hard for them to adjust to someone telling them when medication is due. Work with your resident. Help them to feel that they have as much self-control and input into their medication routine as safely possible. Never rely upon memory when pouring medications into the cup. Always verify the medication 3 times using your 6 rights.
Now, organization is a big part in being a great med aid, so I always make sure that I only have one resident's meds out at one time.
Never carry more than one resident's medication at a time. Never leave a medication unattended. Never give a medication if you feel uncomfortable about that medication pass. If something is bothering you, there's a reason for it. Check with your supervisor to verify the medication being given. learn some very important techniques today to assist your residents safely with medications. Feel free to review this video as many times as you wish. Always ask your supervisor for assistance when needed. In the beginning, you will always have someone watching you pour medications and pass medications to your resident to ensure the medication pass is completed successfully.